People who have ADHD often struggle with three things: inattention, impulsivity, and hyperactivity. And it can manifest in various ways and forms depending on the child or teen's age or even adults. It is one of the most common neurobehavioral disorders, and it is something that I think when kids learn that they have ADHD, there's often a lot of questions because they wonder, did I do something? Does this mean I'm stupid? Does this mean I can't do anything? And the name it says attention deficit. And this is where a lot of parents struggle because they'll often, when they see me, they say, well, my child can focus for hours on Minecraft or, Legos. And yet when I ask him or her to do something over here, it shouldn't take that long. There's a big meltdown. And so there's oftentimes a lot of education that's required about how the ADHD brain works. But I do want to always tell parents that having ADHD does not equate with any problems with IQ. People with ADHD are smart, they're creative thinkers. It's just that their brains think and learn a little differently. Now, the diagnosis often requires a thorough history and then input from parents, teachers, or other people in different settings. So if it's a preschooler, a daycare provider, but oftentimes we need to make sure that we are able to show symptoms in several different environments. But I also like to augment everything that I do with objective testing for ADHD, which it constitutes of a computerized test where we measure symptoms of ADHD in the setting of doing something boring, mundane, non-preferred. So that's how we capture those signs of ADHD. So that, along with subjective reports, thorough history and observation, are what's needed to make a diagnosis. People who are qualified to make this diagnosis can make the diagnosis in kids as young as 4. Previously, people would not want to make a diagnosis before entering formal school around 6 or 7. But, I think a lot has gone into understanding and a lot of research and what we're learning about ADHD is that yes, preschoolers can be diagnosed with ADHD. But, the issue is that, ADHD involves lagging skills in executive function, which means that the frontal lobes of the brain is still maturing until the age of 25. And so sometimes parents are wondering, like, is this normal, or is this just, that my child's just, young for their age, or is this something else? And that's where, I like to tell parents that if you have any question, do not hesitate to talk to your child's doctor. Even though pediatricians routinely give vaccines and do checkups and all of this, they do want to know and monitor your child's behavior and well-being, also emotional well-being. And this is one of the very common things that we see in our office. About 50% of office visits are around behavior and mental and emotional issues. So I would always start with your child's pediatrician. They have the background knowledge of you and your family, but it's going to be important to understand how your child is doing at home and school so we can make sure that it's not just a parenting thing, or it's not just a conflict with a peer at school. It's something that has symptoms that is affecting your child in being able to thrive.